Hi, it's Dr. Janowski for Sonata. We're talking about cellulite treatment. Cellulite, one of the most difficult conditions to treat, and almost everybody has it. So just think of cellulite as these bands that are tethering the skin, causing dimpling, these bands, fibrous bands, of course more often in women than men. So these fibrous bands are oriented vertically, so if we can cut the bands, we can pop those dimples back up, and it really can be as simple as that. So we're doing a treatment today called substitution, where I'm taking a very, very small needle with a little blade on it, and I'm going to cut the fibrous bands underneath the skin, but we're going to do a lot of numbing first. The patient won't feel it, and also the numbing will help prevent bruising. So what I'm doing now, you can take a look here, is I'm just putting numbing medicine in here. I've already numbed the entry points to each one of these areas that I've circled, and each circle represents a dimple. And so we want to simply get our areas as numb as we possibly can. It also has a little bit of epinephrine in there to shrink the vessels and prevent bruising. So I'm going to do this first, finish all the numbing, and then I'll show you how I perform the substitution. Okay, so now we've numbed her up really good, and you can see all the blanched areas where the epinephrine was placed. And so it should be completely painless. It is completely painless. And I'm going to take this very small, what's called a no-core needle. There's a needle with a little tiny little blade on it. And we're going to literally just cut those attachments by moving this blade back and forth like this until they're cut. And we're just going to go to each individual circled area and stay pretty close to the skin surface. There we're in the dermis, the deep dermis, and then we're just going to move that until it feels like it's free of all its attachments, and I can actually feel them breaking as I move that. So we're going to just keep on going here until we get all of them done. Just going to move that back and forth. So that's the simple procedure. It doesn't take long to do. There can be some bruising afterwards. Those little fibrous attachments are not essential for anything. They're just kind of causing the problem. We can break them and potentially do this in a single treatment. Sometimes it may take more than one, but we can get significant improvement in that dimpling contour of the butt's outer thighs and those typical areas. So that's a great treatment for cellulite that you can consider. And if you have any questions, just give us a call.